When discussing the therapeutic approach in the field of oncology, we are primarily referring to three therapeutic strategies, namely surgery, radiotherapy, and pharmacological therapy, which for the purposes of this video, we will simply call chemotherapy. Every therapeutic strategy employed inevitably results in repercussions on the skin organ. When we talk about surgery, we refer to a surgical intervention, and the primary cutaneous issue that the cancer patient must manage and confront on a daily basis is the management of the scar. The scar must be monitored daily to prevent the appearance of bacterial superinfections. The involvement of the physician, pharmacist, and nurse is frequently necessary as well. A proper cosmetic approach involves daily monitoring of the wound and preventing the development of hypertrophic scars and keloids, which can cause discomfort, pain for the patient, and can also compromise mobility. Think, for example, of an intervention in the axillary area, a scar in the axillary area. Should it become hypertrophic, or if a keloid forms, it could also compromise arm mobility. With radiotherapy, the main skin problem that the oncology patient must manage daily is the prevention and treatment of radiodermatitis. Radiodermatitis is a skin lesion comparable to a sunburn, which can be mild, moderate, or severe. Based on the patient's physical condition and the frequency of radiotherapy sessions, an appropriate cosmetic approach for preventing and treating radiodermatitis involves, first of all, preparing the skin appropriately during the period before the radiation therapy session. Therefore, it is necessary to use a cosmetic product that can cleanse adequately, but which at the same time does not leave residues that could interfere with the action of the radiation. After the radiation session, it is necessary to take care of the treated area using soothing and emollient cosmetics that can support the skin. If drug therapies are used, meaning in the case of chemotherapy, in this situation, the skin side effects are manifold and different. This is because each of the classes used inevitably has repercussions on the skin organ. Whether you use taxanes, antimetabolites, anthracyclines, immunotherapy, or targeted therapies such as inhibitors of the epidermal growth factor receptor, in any case, the skin organ is affected. The primary skin issues that arise, regardless of the drug therapy employed, are extreme skin dryness, severe skin dehydration, and xerosis. With drugs that cause hair loss, alopecia can appear. The appearance of hand-foot syndrome is frequent. Mucositis may occur in the oral cavity and intimate areas, and chemical phlebitis can occur if the medication is given intravenously. These cutaneous issues can significantly affect the patient's self-esteem, their self-perception, and can negatively influence their psychological well-being. Therefore, specific cosmetic support may be necessary and very useful to help the skin in such a way so as to ensure both physical well-being and simultaneously psychological and emotional well-being for the patient who is already undergoing a path that is a complex journey. The Oncos cosmetic line was born to offer solutions, although purely cosmetic, effective in alleviating the cutaneous side effects associated with oncological therapies. It is a cosmetic line developed in collaboration with healthcare professionals, meaning doctors, pharmacists, and nurses. That is, professional figures who are involved daily in the life of the oncology patient. Together with the local socio-health company of Bergamo Est, Oncos has published 2 clinical studies aimed precisely at demonstrating how much skin well-being is fundamental at a psychological level for the oncology patient, and how much the daily use of specific and specially formulated cosmetics can provide relief to the patient. These are dermatologically tested products, highly tolerable, certified organic and natural. We will now examine each of the cosmetic products created by Oncos in detail. We will review their cosmetic features and also how to use them in connection with each of the manifesting skin side effects. However, before we go into cosmetology, it is necessary to provide a brief dermatological insight and discuss the hydrolipidic film. The hydrolipidic film is a natural protective barrier that coats and shields the skin. It is composed of a water-loving part and a fat-loving part, hence the name hydrolipidic film. The water phase is made up of water in which ions are dissolved, amino acids, and hygroscopic substances like urea and lactic acid. The lipid phase is mainly composed of sebum produced by sebocytes and free fatty acids generated by keratinocytes. Linoleic acid, ceramides, and cholesterol are the main constituents of free fatty acids. The hydrolipidic film performs a crucial protective and safeguarding function for the skin. The aqueous phase, also called the natural moisturizing factor, allows the maintenance of a slightly acidic pH around 5.5, and this has a very important antimicrobial action. The lipid phase, however, acts like a mantle covering and protecting the skin, obstructing transepidermal water loss, that is, the evaporation of transdermal water, which is a phenomenon. It is continuous, constant, and involuntary, involving the passage of water from the skin surface layers into the surrounding environment. The majority of medications employed in the oncological field impede the synthesis of this very hydrolipidic film. For instance, when discussing targeted therapy, inhibitors of the GFR, the epidermal growth factor receptor, cause a deficiency in the synthesis of the hydrolipidic film. This receptor, the EGFR receptor, is in fact a receptor involved in the mechanisms of skin regeneration and tissue repair, and it is expressed mainly on the skin, mucous membranes, and glandular system. A block of this receptor inevitably causes difficulty in skin regeneration, a difficulty in cell turnover, a lack of ability to retain water, and also to react to any stress and trauma coming from the outside. This implies that the lipid component of the hydrolipidic film is diminished, and as a result, transdermal water evaporation is no longer managed. The skin of the oncological patient is therefore extremely dehydrated, fragile, reactive, and peeling. It has difficulty regenerating, and incessant, constant itching may be present. Knowing the hydrolipidic film, its composition, and also knowing how oncological therapies alter it is a crucial starting point for developing cosmetics specifically for the skin of the cancer patient, as it provides us with information. It gives us facts. In fact, it makes it possible to create cosmetics that are as similar as possible to the skin film, and knowing the molecular structure of the lipids that are part of the lipid phase of the hydrolipidic film also allows us to select cosmetic ingredients that have a composition as similar as possible to these lipids. The vegetable oils and butters selected and used by Oncos including argan oil, jojoba oil, almond oil, shea butter, possess exactly this feature. They are sebum mimetic. That is, the lipid component of these oils is very similar to the lipids naturally produced on the skin. This enables the cosmetic developed by Oncos to be highly dermatologically compatible, ensuring high tolerability. The knowledge of the hydrolipidic film and its composition led Oncos to choose to formulate oil-in-water emulsions, precisely because this type of emulsion is much more similar to the hydrolipidic film. The body cream, created by Oncos, is a cream formulated specifically to support the skin, to support the hydrolipidic film, and it is a cream that has a very important emollient action and is a moisturizing cream and calms. The softening effect comes from shea butter, almond oil, sunflower seed oil, and rice bran oil, while the moisturizing action is provided by glycerin, urea, and xylitol, which are cosmetic ingredients that have a very good moisturizing action, but at the same time are extremely gentle on the skin. Therefore, they are suitable for fragile and reactive skin types. Another important cosmetic ingredient with a moisturizing action included in the body cream is the reconstituted natural moisturizing factor, meaning a cosmetic ingredient capable of mimicking the natural moisturizing factor physiologically present on the skin. The soothing action is provided by xanthalene, an active ingredient extracted from Szechuan pepper, an oriental spice, and it has a significant effect in calming itchiness and reducing redness. Xanthalene is one of the main protagonists of the Oncos cosmetic line. Numerous studies prove its capacity to decrease itching, redness, inflammation, and burning sensations. Completing the composition of the body cream are tocopherol, lactoferrin, and beta-sitosterol, which provide antioxidant effects both for the cosmetic product and for the skin. The body cream should be used many times daily and is great for relaxing massages. To complement the moisturizing, emollient, and soothing action of the body cream, Oncos offers the dry oil, an oil with a dry, light, non-oily texture, which is perfect for both softening and soothing the skin, but also for treating scars. In fact, once the wound has fully scarred over, meaning it is no longer an active lesion, you can apply the Oncos oil daily, even multiple times, massaging lightly onto the scar, both to calm redness and burning, and to attempt to prevent the formation of hypertrophic scars and keloids. If, however, you wish to use the dry oil to moisturize the skin, it is possible to mix it with the body cream. So apply them simultaneously. And the dry oil can also be applied to radiodermatitis after the radiotherapy session is complete. In cases of skin that is so dry, fragile, and reactive, cleansing also plays a fundamental role, and it is necessary to use specific and specially formulated cleansers that respect the physiological pH and at the same time respect and support the hydrolipidic film. Therefore, Oncos has developed a shower shampoo that respects the hydrolipidic film. Glycerin and panthenol provide the shower shampoo's moisturizing action. Keratin allows for a barrier action, and oat extract and panthenol have a soothing action on reddened skin. not only body and scalp, but also face. Oncos has developed a facial cleanser providing moisturizing, emollient, and protective effects, which contains a blend of vitamins for a brightening effect. The moisturizing action is provided by glycerin, vitamin B5, and prickly pear extract, while rice bran oil and sweet almond oil provide nourishment and softening. Xanthine and niacinamide, which have a soothing function, are present inside the facial cleanser, whereas the antioxidant effect is carried out by tocopherol and by lactoferrin. Regarding the face, a small premise is necessary. A specific adverse effect on the facial skin is caused by some of the medications administered during cancer treatments, which is the acneiform rash, a dermatological issue that visually resembles acne, but is not actually acne from a pathogenetic standpoint. For this reason, cosmetics formulated for acne must not be used on the oncology patient. The skin of the oncology patient's face may appear red and irritated. Tiny superficial lesions might emerge, and noticeable peeling could occur. Thickening and crusts may appear, and it is possible to see extremely dehydrated skin. To relieve this cutaneous issue on the face, Oncos has created a moisturizing face cream for a daily restorative treatment in which the butter of shea, jojoba oil, and squalene perform a barrier and emollient function, and the prickly pear extract and xanthine have an important soothing action on the redness and the itching. Besides the acneiform rash, redness, irritations, and small superficial lesions, discolorations may appear on the oncology patient's facial skin, and these can have an negative interference on self-esteem and self-perception. Therefore, Oncos has developed a BB cream, which is a soft emulsion that serves three purposes: to hydrate, even out, and minimize imperfections. As a base, it is a soothing, moisturizing cream containing shea butter, jojoba oil, and vitamin E. The soothing action is performed by xanthine, and also in this case, inside the BB cream, we have as a cosmetic ingredient the natural reconstituted mastering factor. A frequent cutaneous side effect, especially associated with the use of certain chemotherapeutic drugs, is hand-foot syndrome, a condition that debilitates the patient and can even jeopardize their quality of life and the continuation of treatments. Indeed, some of the medications used cause extremely painful inflammation on the palms of the hands, the soles of the feet, and the nails. There might be numbness or tingling sensations. Cracks and sores can appear. The nail might grow abnormally, or there could even be a delay in nail regrowth. It is an extremely painful syndrome that compromises the patient's quality of life, and sometimes the oncologist must intervene and suspend the continuation of therapies until the skin condition improves. To soothe hand-foot syndrome, Oncos has created a specific cream for hands, feet, and nails. The nourishing action, the emollient action, the barrier action is performed by shea butter, sweet almond oil, rice oil, and sunflower seed oil. Meanwhile, Glucose, trehalose, and hyaluronic acid carry out a significant moisturizing action. Inside the hand, foot, and nail cream proposed by Oncos is present a vegetable keratin derived from corn, whose purpose is to support and protect the nails. Lactoferrin provides the antioxidant action, a molecule that is extremely interesting at the cosmetic level because in addition to having an antioxidant action, it also prevents the proliferation of pathogenic microbes. And inside the cream are present ceramides and derivatives of lactobacilli fermentation that play an important role in supporting the skin's microbiota. The hand cream. Feet and nails should be applied daily, even multiple times a day, starting from the days preceding the start of therapies. And if the hand-foot syndrome has already appeared, it is possible to put it in abundant quantity on hands and feet and create a real compress. If the hand-foot syndrome is particularly severe, then in that case, Oncos has created a specific cream called SOS Derma. Inside this cream, there are also two neosomes, Neosensil and Noosoma oligo 3D. The neosomes are specific carrier vesicles that in cosmetics are able to transport lipophilic and hydrophilic actives simultaneously more in depth. Neosensil is a neosome inside which is present a yeast extract enriched in zinc, alpha-mangostin, and magnolol. These actives have an important and powerful soothing action. However, inside the Neosoma oligo 3D, there are 3 different types of hyaluronic acid with different molecular weights that have an important hydrating action. SOS Derma has not only a soothing effect thanks to the neosomes and beta-glucan, but also performs an important emollient and protective action. It actually contains shea butter, rice bran oil, and sweet almond oil, which support the hydrolipidic film. The hydrating action is performed by urea, glucose, and fructose. Lactoferrin is present, tocopherol and beta-sitosterol with antioxidant action, and regarding lactoferrin, also antimicrobial action, and xanthine and niacinamide perform an important soothing action on the burning, the itching, and the redness. Not only dryness of the skin, but also of the mucous membranes, so dryness in the oral cavity and intimate areas. This is because oncological therapies act not only on skin cells, but also on glandular tissue, and therefore production of saliva is reduced, if not completely inhibited. Saliva production. Besides the oncological pharmacological therapies, radiation therapy in the head and neck region might also destroy the salivary glands. And at that point, a profound dryness of the oral mucosa would be created, and one could arrive at having a xerostomia, which is precisely a pathological condition of the mouth characterized by extreme dryness. In order to relieve this skin problem, Oncos has developed a specific mouthwash named Xerogel, which imitates the saliva that is physiologically generated. It contains glycerin, trehalose, and hyaluronic acid with moisturizing action. The soothing effect is carried out by xanthine and lactic acid, and the defining cosmetic formulation feature of this mouthwash is that of having inside a mix of cellulose polymers capable both of giving stability to the formula and of optimizing the sensoriality. The Xerogel mouthwash must be utilized whenever necessary, potentially multiple times throughout the day. It must be held in the mouth for a few minutes, and like all mouthwashes, must not be swallowed. Regarding the intimate zones, however, Oncos has developed both an intimate gel and an intimate wash designed to alleviate dryness, itching, and general discomfort. In the intimate gel, the moisturizing and emollient action is performed by glycerin, hyaluronic acid, and beta-glucans, while shea butter and apricot kernel oil perform both a soothing action on the discomfort and an emollient action. The relief action for itching and discomfort is provided by xanthine, prickly pear extract, and neosensil. The neosoma, which we already mentioned in connection with SOS Derma. The intimate gel is applicable as required based on necessity, several times a day, or according to the advice of the doctor and pharmacist. The use of the Oncos Intimate Cleanser improves and enhances the action of the intimate gel. The intimate wash formulated by Oncos has within it a tea tree extract that acts as an antibacterial agent. It includes aloe and shea butter inserted to hinder the dryness of the mucous membrane, and xanthine to relieve itch and burn. Glycerol and vegetable sorbitol provide immediate hydration and rapid relief for discomforts connected to dryness. Should the drug treatment is administered intravenously, phlebitis may occur, which is an inflammation of the vessel walls. It is an extremely painful symptom, and the area where the needle is inserted may be swollen, red, and there can be pain. Furthermore, the fact that these infusions are often slow and last for quite some time, sometimes even several hours, must be considered. Thus, the trauma at the site of needle insertion is extended, and the medication itself has the potential to cause, due to what it is made of, irritation, resulting in a phlebitis known as chemical phlebitis. To prevent phlebitis from occurring and also to alleviate the symptoms if phlebitis is present, Oncos has created a specific cream, a light emulsion, which is called Salvaven. Salvaven has almond oil inside, rice oil, and niacinamide providing emollient and soothing effects. Bisabolol enhances the soothing action. Biglycyrrhetinic acid and melilot extract. The extract of melilot, in addition to having a soothing action, has an important protective action on the vessel walls, on the capillaries. Numerous scientific studies prove its beneficial effect on microcirculation. This is why it has been incorporated into the Salvaven cream. The moisturizing, emollient, and protective action is completed by beta-glucans and the T3 extract. The Salvaven cream needs to be applied every day onto the site where the needle is placed, and can be applied several times a day, and you can start using it even in the days preceding the start of the therapies, in order to prepare and support the skin. Concerning the cosmetic makeup of Oncos products, taking into account the high dermocompatibility of each cosmetic item, the high tolerability, and considering that these are products formulated for the skin of the cancer patient, meaning extremely fragile and reactive skin, one can confidently state that Oncos cosmetics may also be utilized when other cutaneous issues are present, not strictly related to the oncological field. Therefore, they are moisturizing, softening and soothing cosmetics that can be used when dealing with someone who has extremely sensitive skin. Like when atopic dermatitis is present, when there is psoriasis, or in general when we are dealing with skin that is generally extremely delicate and reactive.